Okay, I had been in a car wreck in 1993, November of 93, sustained whiplash in my neck. And I'd been through all kinds of treatment, virtually everything, all other kinds of chiropractic treatment for years. I'd gone through just different kinds of therapy, trying to get the situation resolved, but it straightened out my neck and I'd lost the curve in my neck. And my pastor's wife is the one who turned me on to Chelsea, I think. And I talked to her and she invited me to a dinner with the doc, so my husband and I came. And that's how we got connected. His regular therapy hadn't really helped me. It had helped me to a point. I had bad migraines all the time. And whereas it would help kind of ease the pain, it didn't get rid of the problem. And so I came here and had x-rays done. I got to see my spine and the mess that it seemed to be. But anyways, and he adjusted me and my migraine headaches went away. Like, just almost instantly, they just disappeared. Now when my neck goes out, a migraine headache will come on if it's out long enough. And as long as he keeps me in, those severe headaches are gone. And it has really helped my overall spine. I still have some issues that obviously have to heal from the injuries. So I had a couple different injuries. The one in my neck was from the whiplash, and then I had sustained an injury like in my low back when I was pregnant with my 5th child, and it went out, and there's just issues going on back there, but as long as I keep proper alignment, those things stay in check, and I don't have near the problems that I used to have. Well, the first 3 months, there was such a shift in my spine and such a shift in the way I felt, is that the first 3 months, you're here a lot, and I initially would go out about every 2 weeks to a month. This time it was my right sacrum and pain shooting down into my leg, and my foot actually goes from here all the way down. Sometimes I notice it first in my neck and my head, and sometimes I notice it first down here. I don't know why, it's weird.
So I'm looking for leg length inequality. Whenever the atlas is out, the body will twist and tighten up in that low back to try to keep the head and eyes level. And that can show up as asymmetry in leg length because those low back muscles are also pulling up on the pelvis. So you'll tend to see one side of the posture pulling up. For Cindy, when she's out, it's her right side about 1/4 of an inch. For her, it's getting her a little higher up and stabilizing her head on the headpiece better. Those are the only factors that are showing up on her x-rays that show the stubborn side. No, it's getting her to relax. When somebody carries that tension, they don't release as well. Give me the tiniest little scooch up towards, yeah, there you go, perfect, good. T7, C7 EOP all lining up.
Then I finally held one time for like 5 months before I went out, and I've gone through, got out again or whatever, several times. I don't know why, but just I go through these seasons. But I held for 5 months. But after the first 3 months of really seeing the change in my body and the change in my pain level, the change in how I'm feeling, and then just seeing it on the x-rays, the change in my spine, things that I didn't think were physically possible to even be corrected, were correcting. And I was sold at that point. My husband came when I came, and because he was having some issues with his low back and I think even his upper back, but and he's been helped through the treatment.
Thrown under the bus. I feel tight. Okay, so I don't feel the C2 dorsal root inflamed.
Okay.
Right? Like that's that little spot where it'll be inflamed. It feels clear to me.
That's not sore at all.
Exactly. What I'll feel is down through here. Yeah. Could it be how you're sleeping or anything, or?
Could be.
Is there something that you're doing repetitive that would put demand like that? Or
not on purpose.
Like that? Because sometimes when a muscle's stretched fully out like that and you gotta move, you can spasm it. Or if you're doing something repetitively where you're putting demand on it.
It was really probably within that first 3 months that I saw this big change in myself. And I knew my son, my middle child, needed to come because he had been in a wreck like I had been. And he's now here.
What do you notice? A little skinny there, right?
Yeah.
A little skinny there too.
And the curve, it's straight,
Exactly.
not that curve you're talking about.
So that's typically evidence of a whiplash.
Yeah.
The atlas is actually relative to the skull is shifted to the left and gone posterior slightly. The C2 is really cranked hard to the right. And then the cervical spine is nearly neutral. So whenever you hit, it locked up and compensated like that.
Okay.
So you'll be on your side. If you can imagine, the headpiece is relatively sharp that'll lock your head in place.
Okay.
And then I'm going to be on twisting and pre-stressing all of those relationships back towards zero.
Okay.
And then the last thing we're going to do, once everything is set, is the arm that's at the head of the table is going to line up. I'm going to line the instrument up on your math. So for you it's going to be about 18 degrees and coming from posterior at about 2. And then I'm going to be aiming at that atlas to finally get it to set and release.
Okay.
And with everything lined up and ready to go, it's going to release into normal position. All right, any questions?
No, no.
All right, otherwise we'll shoot up front.
How you feeling since last time?
I haven't had any headaches at all. I've just been more active and able to do stuff. I'm not had any headaches so much anymore.
Work-wise?
I do roofing.
Roofing. Oh, okay.
So
So
I would notice it.
yeah.
So I was on the job, which normally it's really hard to. I had to call it early a few days because it was just too bad. But since the first week was a little rough, but after 2 to 3 weeks, I haven't had any problems since.
My daughter has had issues with her back and like even her leg being numb, like mine I've had issues with, and she's here and doing much better.
I have had fibromyalgia my entire life. I know that's more nerve related, but also like had 2 bad knees, and one of my legs was like completely numb on one side for the past few years, and I'm actually starting to feel a little bit since my first adjustment on this side there. And like migraines, my back being thrown out, you name it. I've had several chiropractic adjustments, but they don't really do the trick. It's more like a temporary fix, Honestly, like my body's like adjusting to it, but I have noticed that I don't have pain as much pain when I'm like sitting down. Like I was just laying down, and usually my back gets really tight and painful when I'm laying down like that. I sat up and only hurt a little bit.
And then we've got our 2 youngest boys here, and they're doing great. And even Jaden with his Tourette's, he tics a lot with that, but when he goes out, his tics get worse. So I have seen a shift in the severity of the tics when he is put back in versus when the stress starts to build and he starts to go and then he pops back out, and the tics seem to get worse, and they do seem to be better when he gets that realignment, which is a blessing. Go and get your neck checked. Just go and talk to him and let him do the x-rays, let him show you what your spine looks like, and just go through the treatment and just see for yourself if you're better, because other treatment, if you're still suffering, other treatment isn't helping. So I would say just go get your neck checked and let him tell you about it, because you can't lose anything. You might only have your health to gain, so just do it.
Sure. Hey guys, keep it up. You're doing great.
He wants you back in here.
Yeah.
I'll put you on the layaway plan.
Elbows in your lap. Elbows in your lap. There you go.
Well, I'm losing my mind.